15 participants, sir.
Okay, no problem. Carry on.
Okay. So, good evening, everyone. So today we are having our 15th session on this 3-month training program on psychosomatic disorders, and today we are also continuing the same topic, that is phobias. So before that, before Ganeshan sir takes the session, I would like to invite all the participants, WCOP core committee members, chief patrons and patrons, Brother Ganeshan sir, J.V. Lakshmana sir, Ganesh, B.G. Reddy sir, Ashok sir, and all the participants. Once again, a very pleasant evening. So we shall start with our continuation session on phobias. So I request all the participants to be ready with your cases. Even if you are heard somewhere or someone has asked you, or whatever you feel, any case of phobia you can discuss here. So I request B.G. Reddy sir to take lead the session. Initiate it.
Once again, good evening to all, particularly our Professor Vedagiri Ganeshan sir, who especially on behalf of WCOP and on my personal behalf, I am inviting him with folded hands. And I'm also inviting the so-called chief patrons, and the executive committee members, core committee members, and the beloved participants. You know, today also we are continuing the topic of phobias, and mainly we are going to have, first we are going to discuss on fear of cockroaches, fear of lizards. And will, as the participants also, they can ask on their own field if they have come across any kind of phobias. Then, you know, I hope the participants might be just writing down, only you are copying out, giving counseling. You can just say one pranamas to Ganesh sir, and you can start the counseling, then automatically you will be successful. I hope you might be writing down the so-called summary written down and just kept in the WCOP, psychosomatic disorders WhatsApp group by our repertoire. Right. Anyway, she is taking so much of struggle. She is also preparing for the examinations. Anyway, but apart from that, she is doing a wonderful job and really appreciate. You know, see, coming to our course coordinator also, Ashok, is also doing a wonderful job. So it is a teamwork, and by the side of me, another technical gentleman is there. Without him, we can't run the program. He's a beloved student of mine, erstwhile psychology colleague. Just I am just feeding psychological techniques to him also. Just you can show your right. So
welcome, sir.
Yeah.
Namaste, madam. Namaste.
Right.
Namaste, sir. Ganeshan, sir.
Right. Right, sir. We'll go ahead. Just Ramadevi. Once again, welcoming you all to this 15th session. Right.
Okay. So may I now request Vedagiri Ganeshan sir to lead the session on phobias. So there is a question from last week, sir. There was one in chat box. Can I ask?
Yes, you are the beginner. You ask.
Yes. Yes. Welcome, Ramadevi.
Sir, it was about, there are two questions. One was asked by Shahina madam and one with Tanvi. So I will go with Shahina madam. She has the fear of driving a car, sir.
Okay.
And Tanvi, she has a fear of closed rooms.
Closed rooms. Okay.
Yeah. Fear of driving and fear of closed rooms.
Okay. Before we talk about the techniques, I would like to say that this behavioral medicine is coming in a very big way, which is to be taken up by psychologists, psychiatrists, social workers, MDs, including surgeons with various specialties, because certain things are handled by anatomy and physiology, etc., pharmacology, but there are disorders known as functional disorders. The functional disorders, I mean, it's very large, including extreme psychosomatic cases, extreme psychoticism, neuroticism, everything comes under this area of behavioral medicine, where instead of medicine, We have to prescribe behavior and we have to administer and train the person so that they come out of their problem. Now, Rama Devi has asked a couple of questions or problems. One is fear of closed places. Another is, what else is there? Rama Devi?
Car driving, sir.
Car driving. Okay. Now, you see, one of the things is it requires the imagination of the therapist to transfer from one area to another area. Okay. Suppose we say something about flight, the fear of flying. The same thing can be applied to car driving also. So, I have already mentioned that this requires the imagination and then drawing from elsewhere and applying for solving this problem. I have told about fear of flying for a bomber flight pilot.
Yes,
The
sir.
car is also, it is on the move. So let the car be stationary without starting. Ask this person to sit there and relax, sing a song in a stationary car, or eat an ice cream or whatever food the person likes. Then the stimulus is the car, and the response is pleasure, enjoyment, ice cream, or listening to music, or singing, or even dancing, slightly dancing within the car. That's all. It's a stationary car. So, neurologically, psychophysiologically, the system, the person, the client learns to respond differently than with anxiety with regard to the car. It's a stationary car only. It is again a systematic hierarchical desensitization. Then let there be a driver who moves the car for 1 foot and stops. Okay, no problem. Slow breathing out of the mouth, breathing in through the nose, just 1 foot movement. Then 2 feet movement, 3 feet movement, and stop. So this person who is phobic in driving, traveling in a car, he may be even a minister. Sometimes they fly, but they cannot go by car. Okay, that becomes a problem. Some of them are engineers, some of them are doctors. So it actually incapacitates them from functioning fully. That's a whole problem. And it cannot be treated with medicine. So this is a systematic hierarchical desensitization. So move step by step, step by step. The brain is learning to relax. It has learned to be tense and stressful, and that is the problem. It is a hypersensitivity to car. So you have to desensitize and ask the person to drive the car, start the car, and switch off. No problem. That is one step. Then start the car, move, switch off. Again, move 5 feet, stop. Right? Like that. Then they will come out of it. So that is once it is told, it is simple. But before telling, it becomes difficult. How to solve? An MD cannot solve. A psychiatrist cannot solve. A surgeon cannot solve. And that is why these things are coming under behavioral medicine. It will be taught in future in the classes of psychologists and also in the classes of MBBS and MDs. Okay. Because there are many unsolvable problems which appear to be very complex. And it is because they have learned wrongly. Faulty learning has come and it is affecting the system, and the effective functioning of the person is affected. Okay, and this is a kind of interdisciplinary area where psychologists can contribute a lot. Okay, because we are familiar with the learning. So that is with regard to the car movement. Another thing is claustrophobia, closed places. I have already suggested a closed place, for example, can be a lift. Okay, so get into that laugh, jump out, laugh, get in, laugh, jump out, laugh, okay, and jump into the lift and say 1, 2, 3, 4, jump out. Again, jump in, count 1, 2, 3, 4, 5, 6, 7, 8, jump out. The same technique which I have suggested in treating phobia towards darkness. Okay, so from one area to another area, you can make a jump. So you have to remember certain things, and the basic principle is gradual introduction of the agitated person to the stimulus, threatening stimulus. So this is the solution. And as I know, a professor from a science department in one of the Andhra universities, not Andhra University, but one of the universities in Andhra, he came out of it, out of the darkness phobia. He was about 55 years old, okay, and he got his PhD from IIT Chennai. That knowledge is there in the left brain, but the confusion is in the right brain. So he was almost behaving like a kid. He cannot come out after the sunset. Only after the sunrise he will come out. The darkness phobia was treated only using this kind of method. Same thing can be used for car phobia or the claustrophobia. But only thing is you have to be there to train the person. It's more of a training. You are a coach and you are taking the client and you are treating, they become all right. Otherwise, pharmacologically, nothing can be done. Surgically, nothing can be done because it's a functional illness. Most of the psychological problems are functional illness. Structurally, things are okay. Brain is okay, nervous system is okay, but it starts misbehaving. Due to faulty learning, it has become a habit, okay? So the person is suffering and the person is not able to function as a fully functioning person. That is where this interdisciplinary area can come, and it can be taught to neurologists, neurosurgeons, physiotherapists, psychologists, and people who are coming for this program also. I want everybody to ask a question or present a case. Please do participate. The senior people are always there, but then the youngsters, you should come with a question or a problem or imaginary doubt also you can have. You need not meet with a case. Okay. Yeah, please start. I would like Nelson to ask a question because I am familiar with Nelson. He was my doctoral fellow. If Nelson is there on the line, please come forward, Nelson. Otherwise, Suresh Kumar, Padmavati, Satyavati, because I am noting names from the screen. Manvita, Rani Banda,
Good afternoon, sir.
Dr. Venkateshwar.
Good afternoon, sir.
Yes,
I'm Nelson.
yes, please.
So see, I had a
Please tell your name, Nelson. Yeah, tell
I'm
me
Nelson. Yeah. See, I had a case 23 years old.
Okay.
He's having some problems with the he's having problem with the sexual thoughts and all that.
Okay.
So whenever he sees a woman,
Yeah.
wherever it is, even the relatives and house members and all that, he's having sexual urge for them, especially even towards the family members also. He said he didn't used to see such type of videos, but he used to see just some normal type of videos. But he had such a sort of urge that he's unable to control it, and he says he wanted to stop doing masturbation, but he couldn't do that.
Okay.
So he's in a great trouble. Even though I have asked him to do something like that, but he couldn't do anything. He's in a very utter bad condition. So what to be done?
Okay. Okay. Now, I would suggest to you to give him genital muscle relaxation technique. That is the first step. Second step is ask him to switch on the videos, okay, triple X video, and ask him to laugh. Ask him to watch the triple X movies or videos and continuously start laughing. Switch on the video, keep laughing, because his response to such videos, he is obsessed with that and he cannot stop it. Okay. So if he starts laughing, his addiction to watching phone videos will stop. It is a guarantee. Ask him to do that. Okay.
Also
And
get
also, third thing, ask him to sit at the roadside and watch women crossing. Okay. Look at them. Breathe out through the mouth, inhale through the nose. So more oxygen intake is there. If you breathe out, is breathing out the wasted gases which are sexually aroused hormones in the blood. They go out. It's just like an exhaust fan. So let him say, breathe in through the nose, breathe out through the mouth. Real people crossing the bus stand or whatever by roadside. Look at the women and do like that. Okay. And his stimulation with the family members, including mother or sister or grandma, will disappear. Otherwise, you will have a sense of guilt. Okay. And ask him to masturbate only once in a month. Okay. The Western literature says masturbation is okay, but the Indian ancient literature says it is unnecessary. If he is not married, ask him to get married. Okay. Is he married or not married?
no, not married.
What is his age?
23, now 24 maybe.
Okay. Ask him to get married as early as possible.
Okay.
Okay. Then he can have actual sex with his wife so that both of them will be benefited. There is no use of masturbating. Okay. And that creates an addiction and creates a lot of problems. This is again a kind of a problem which will lead to serious labeling by psychiatrists and clinical psychologists. So it is better to treat in the beginning level itself. Anyway, I'm happy to know that you are handling such a case. Please go ahead.
Thank you, sir.
Okay, Dr. Nelson.
Okay.
Sir,
Yes,
good evening,
Dr.
sir.
Yes,
I'm
Dr.
Dr. Venkateswara, sir. Good evening,
Yes,
sir.
yes.
I have a lady client, sir. She is MBBS student.
Okay.
She came to me. She is not able to pass the examination of gynecology. Whenever she enters into the practical room, she is not able to see the blood, the child coming from vagina, and she is not able to see that boy in that situation. She is fearing,
Okay.
sir. She is not able to appear the examination. She is getting good, is scoring good marks in all subjects except this
Okay.
subject. So she is
Which
fearing that
subject?
she is not in
Which
gynecology,
sub-
sir. Gynecology.
Gynecology. Okay.
Even though she is lady, I asked her
Okay.
how you have dissected a frog. She told that is a frog I can do, but she is a woman who I cannot do. I am also woman. How can I counsel her, sir?
Okay.
How to remove fear in her mind?
Okay. Okay. Now, you are talking about a C-section for a gynecologist or what?
Yes, sir.
Okay. Now, again, she needs to be desensitized. Okay. First of all, ask her to get into the theater. Ask her to look at the wall and slowly breathe out of the mouth and breathe in through the nose. And if she faces any tension, ask her to take more and more water to the level of satiation. This will give her more intake of oxygen from the water. And also breathing out through the mouth and breathing in through the nostrils. Okay. Then ask her to turn towards the surgical table with eyes closed. First, she will be looking at the wall of the theater. Next, she will turn to the surgical table with eyes closed. Ask her to do the same thing. Okay.
Okay, sir.
It is to be done for half an hour. First thing for half an hour, second thing for half an hour. Third thing is let her open the eyes and close. Open the eyes and close immediately. Okay.
Yes, sir.
And ask her to do it for half an hour when the C-section is going on. Okay. By doing all the three steps, her system, her brain and the body, autonomic nervous system would have come under voluntary control and she could relax in the theater.
Okay, sir. Thank you, sir. Thank you so much.
Ask her to do
Sir,
that.
one more doubt I have, sir.
Yes, Dr. Venkateswara.
My wife is a dare dashing devil, no problem.
Okay.
But when she can fight with anybody on the earth, no problem.
Okay.
But she feels suffocation while she is in the queue, sir. While going to darshan of Lord Balaji or Narasimha Swami temple, when she is in the queue, she will unnecessarily feels that she don't get oxygen. Nowadays, every area is covered with fans and lights also.
Yes.
Even though
Yes.
she will feel that she is not getting sufficient oxygen, suffocation she will feel.
Oh, I see.
Actually, it is in her mind. Actually, the persons we are along with her, we are getting, there is no problem. All are getting oxygen and air, but she feels that she is not able to get, and she feels suffocates, and some type of fear she will get, sir. How to
Okay.
control that, sir?
No, is this a fear of crowd? Can you say?
Crowd, no crowd, only
In the
queue.
temple, crowd
When
is
she is in
there.
the queue, and the crowd, there is no problem. She can go any jatara or she can go to the market freely. There is no problem. When she is in the queue in the temple
In the queue, okay.
or in cinema theater, she will feel that
Okay.
suffocation.
Oh, in cinema theater also she feels like that.
Yes, sir.
And also for going to Tirupati, she has this problem.
Yes, sir.
Yes. But
Mainly in
ask her to-
Ahobilam, like such temples, down,
ask her to
down
go to-
low height temples.
Okay. What I suggest is ask her to go to Srinivasa Mangapuram,
Sir.
where there is no crowd. No crowd. Let her not go to Tirupati. Okay. So let her go to Srinivasa Mangapuram. Okay. Then she will not have any problem. Crowd is less because I have gone there.
Sir.
That
Great.
is one thing. Another
Correct, sir.
thing.
When she goes to Srisalam also, she don't feel like that. When she goes to Yadagiri Gutta, near Hyderabad, Yadadri,
Yes.
that is Ahobilam. It is inside the temple in the ground level, God will be there.
Yeah.
So
cave.
while entering into the terrace, she will feel cave.
Yeah.
Yes, sir, cave.
Yeah, cave.
Narasimha Swami always he will be in the cave because he is a Girijan God.
Yes.
He will be in the caves only.
Yes.
When she will enter into the cave, she will fear and sweat also comes, sir.
Okay.
Sir.
Okay. Ask her to lie down, close the eyes, and imagine that she is going to Yadagiri Gutta.
Sir.
Okay. So it's a imagery treatment before going to the actual Yadagiri Gutta, which I also visited when I was in Hyderabad. So it's a cave temple. Okay. Ask her to lie down and imagine that she is entering gradually into the temple. Ask her to again repeat it 10 times. Okay. Only in imagination. Then take her to the real situation. Real situation is known as in vivo. When she does it 10 times, lying down, because she knows she is not in Yadagiri Gutta, but she is preparing her system to be relaxed with the imagery of entering into the sanctum sanctorum of Yadagiri Gutta. Okay, by visualization, she can do it.
Okay, sir.
Ask her to do it 10 times and she will be able to go to the temple.
Thank you, sir. Thank you so much.
Welcome.
And again, this lift problem also is there, sir. In open lift also, she will feel suffocate.
Okay.
She develop a fear.
Okay.
If it collapse, her cage will collapse. or how can I survive? Like that, she will feel unnecessarily. Even in open lift, it is not a closed case, but in
Okay.
open case also she is feeling.
Okay. I have already
She is using only
suggested.
staircase.
Okay. Now, with regard to the lift, I have already suggested.
Lift you have
Ask her
suggested
to-
for children, I think, sir,
ask her
but this
to-
is a grown girl, 40, 50 years. She is
What
not
is the
able to
age?
jump. People say that it
What is the
50
age?
years, sir.
Okay.
50
Ask
years,
her to-
50.
Okay. Ask her to step
If
into
she
the.
jumps inside and outside, people will feel. And she is
No,
the vice president of the apartment. If she jumps
Okay.
inside and outside, people will.
No. That
People
is
will.
the time at which there won't be any crowd. Choose a time at which there won't be much crowd. Okay.
Sir.
Like in the lunch time, people will not move out. Okay.
Sir.
Or in the late in the evening, people will not be there. So at that
Sir.
time, ask her to step into. She may not jump. Ask her to step into the lift and start laughing and come out. Again, step into that, laugh and come out. Keep it open. Don't close the lift. So it's only an empty lift, stationary, not moving
Step in
up
and laugh.
down. Yes. So she can step in and laugh aloud and come out. Again, ask her to do it 10 times. So her brain, you are training the brain to relax by laughing, being inside the threatening stimulus, which is a closed place, which is the lift. Okay.
Okay, sir. Thank you, sir. Thank you so much.
Try that and come back.
Definitely, sir. Definitely, sir.
Welcome.
Definitely, sir. Definitely. Thank
Welcome.
you, sir.
Hi, sir. This is Vinusha.
Yes, Venusha, tell me.
Sir, previously, sir mentioned a case, right, sir? So, in both of the cases, don't we think that if she is very closed enough, she might feel suffocated because of the crowd or something, if it is closed enough?
Yeah.
Can we derive like that?
Yeah. You see, for example, one is the space. Another thing is the crowd may be pressing on her. See, when somebody walks in a queue, somebody will push or come in the side and then they may press the person, so which she may not like. Okay. So what is
Yes, sir.
required is she should develop the stamina to push back. Push back. When somebody comes and leans on you, push back. Then you will not be afraid of people coming and touching or leaning on her. So you can do it for fun. Okay. You stand by her side and you push her, and she has to push you back. So maybe family members, sisters, mother, husband, they will push and she will push back. Okay. So she develops the capability to handle a situation in which she is likely to be pressed in a crowd from the back or from the side. Okay. So train her brain to tolerate and to counteract, not only tolerating, counteracting also by pushing back. So you try that, and she would have developed the skill to push back instead of becoming afraid of being touched or pushed away by the crowd. This is what happens when the crowd is there. Somebody is smart enough to push you away, and you are hesitant. Why I am being pushed from the back or from the side? Okay, so you should also learn to push back. Trainer, it becomes a play. It becomes a relaxation. It becomes an alternate response than to become afraid of. Instead of becoming afraid, ask her to counteract. Okay, try that. You will ask how many times. I will usually say 10 times. Today 10 times, tomorrow 10 times. Okay, 4 or 5 days. Then she will be able to go into a crowd. She lacks the skill to counteract anybody pressing on her. Okay, try that.
Yeah. Thank you,
Right.
sir. Sir, there is another case where they're unable to step onto the escalator. When they are young, they used to go on the escalator, but not sure these days, going near the escalator is a problem to them, and they are afraid and they are choosing to go through lift.
Okay. What is the age of the person?
49.
Say around 50. Okay.
Mm.
Now, you switch off the escalator, or when the escalator is switched off, ask her to climb the steps and climb down, climb up
Okay.
and climb down. Because her brain learns whenever she looks at the escalator, she's afraid. Okay. So without movement, if it is stationary, ask her to climb up and then climb down like that. Okay.
Stationary.
Yeah, stationary thing. Then our brain will accept. Okay. Otherwise, just by looking at the escalator, our brain gets agitated. Okay, and she will start sweating or have a heavy breathing, etc.
Yeah, when we are forced to climb, she's unable to, she's
Don't force. You follow this method. Okay, forcing it will not help. Ask her to go up and down. Okay, with a stationary escalator, and her brain learns to tolerate the escalator. Then be friendly and say, "Come with me," and then hold her hand and stand with her, and then she will be able to go. Try this and come back.
Sure, sir.
Everything requires a technique. And then there is a cost. What is the cost? Your time. The therapist's time to be spent with the client. That is the second thing. So if you have the technique and you have the time with the client, things will become all right. Say surgery takes time. Expertise is there, but surgery takes time. You can't have a quick fix where surgery is required. Okay, and the client will come, but you have to persuade, and you should spend your time with the client. And that results in good outcomes. Okay, Vinishnu.
Sir, Ganesha sir.
Yes, please.
So, my observation,
yes,
as far as Venkateswara Rao's wife's case is concerned,
okay.
Generally, I too might have experienced when I went up hills. My co-brother's son came once.
Okay.
He came for he has passed in 10th class. So my wife entrusted me to take him up hills. Myself and that boy, we went up hills. So we entered into the queue by 10 o'clock.
Okay.
There are waiting halls. See, peculiar situation is as if they are going to give darshan in another 1 hour. They have not allowed to sit on that hall, sir. So immediately we just rushed into the rush. We rushed and we were standing in the queue for we entered by 10 o'clock and we waited with ghee bear sounds, all ghee bears are all nonsense because suffocation. When they are in suffocation, for this simple thing, why should we come here just waiting and standing for fast more than 5 hours? And old people, 80 years old, 85, 90, and small kids. The situation. These people, the small children cries, and the old people also grumbles with the ghee. Basically, there the person, Venkateswara Rao's wife, basically she needs much action, more action. Why she needs more action means in family situation also we might have observed. See, for me, just fan should run in 1 or 2 condition. But my wife needs 5 button system so that she needs more air. For me, it is really, if it is 1 or if it is 2, okay, fine, comfortable. But for some people, they need more. If they just switch on in a 5 point only, they feel more comfortable. And similarly, in Venkateswara Rao's case, she needs more oxygen. And here I got another doubt also. Basically, whether Venkateswara Rao's wife basically just standing in the queue and going to the have darshan of any temple, any god, basically she might not be liking. That question I wanted to get clarification from Venkateswara Rao, number one.
Yes.
Number two, here generally we have seen mental I have visited many schools also. Then the so-called collector of Anantapur also, long back 2001, he has conducted a program of Asara. Asara in the sense, here just 4 types of disabled. 4 types of disabled. One is visual disabled, hearing impaired, then this hearing, then this mental retardation and so on. When and other schools also just I visited and just we were just testing. We are giving percentage of mental retardation in the schools also. These teachers having studied B.Ed, they have studied, M.Ed, they have studied. No, simply the gentleman comes and stands just behind the boy. So boy basically below there are 4 categories of children. One is a backward child, backward in the sense intelligence level is so low. And immediately the teacher starts telling, sir, this boy mind loose. I said, he is not having mind loose, but first of all, you set right your mind looseness. I used to comment.
Okay.
See, these people, they are aggravating the situation. So,
Yes.
yeah, even in the house, a person who is suffering with some kind of mild mental retardation at home, then these people, they themselves used to call, hey, gentlemen, you are suffering with OCD. These people are commenting, and including mother, including father, including his own sisters, brothers, you are running with OCD. Like that means, similarly, in coming to this society also, and including teachers, because of their comments, their mental retardation will be at 10 point or just percentage or 20%. With these comments influences to increase their own mental retardation up to 60%. So this is purely because of the people who are surrounding that particular guy.
Yeah.
First of all, this should move. This should go away.
Yeah, that's right.
Yeah, for that we should give kind of awareness.
Training has to be given to the caretakers and the teachers.
Yes. And in our midst, our Sudhakar Reddy is there. I came to know from other doctors. He is a very good surgeon. Once he has also commented in the webinar, 1,500 brain surgeries he has done. Not even a single case failed. That was the expertness of Sudhakar Reddy. But what other doctors used to comment again as Sudhakar Reddy? No. He takes a lot of time. But you are telling that the therapist should spare much of their time to attend to the client.
Yes.
So when the therapist spares a lot of time or much more time, then automatically the client develops a kind of we feeling. So here is a person. So I can depend on him. He is helping me. So definitely I will be overcoming my problem. So that is the just understanding and interact and that bondship builds with the client as well as the therapist or the counselor. Sure. There are people just okay, sit down. Yes, tell your problem. Like this, they are hurrying up. No, they are not counselors. I mean, but counselor should have lot of qualities. First of all, they should have patience enough. That is one of the best qualities.
Yes.
So Tom, Dick, and Harry can generate excellent counseling, sir.
Yes.
Many people cannot. They are misfit for counseling. And family counseling, even 20 years, unmarried girls are doing, unmarried boys are doing. That is totally wrong, I can say. What they do know about family experiences? They do not know the mechanisms.
Yeah.
Yeah, these are all most important as far as counseling therapy is concerned.
Yeah.
What I feel.
Yes, sure, sure. They have to invest time. And if they have compassion to the client, they can invest time. They should not be mechanical. They should not be income oriented, but they should be result oriented.
Yeah,
Then they
attitude.
can-
Attitude to help the
attitude.
client,
Help the client.
not
Yes.
collecting the money.
Yes, yes, yes.
First of all, they should keep it aside, collecting the money.
Yeah,
Collecting
yeah.
the money, people, they are not good counselors, I mean.
Yeah, that's true. True.
That is just I am passing the message to the participants also.
Yes, yes, sure, sure. I agree with you. Yes, Professor Sudhakar Reddy, you would like to say something and join us? Please unmute the mic and then speak. We have not seen you for quite some time.
Sorry, am I audible, sir?
Yes, yes, you are audible. Yes.
Sir, I'm having cold, sir. Excuse me.
Okay, okay.
Yeah. Actually, when sir said, you must have a lot of patience and to establish rapport with the patient. You must really spend naturally long time so that rapport will be established between the patient and the counselor.
Yeah, sure.
And the counselor should have a lot of common sense and
Yes.
life experiences
Yes, yes, yes.
so that he will have solutions in his mind already and he can suggest those solutions to the patient. Just like Ganesh sir, how you are giving the solutions. Every counselor should give solutions which are already having in his mind, the life experiences, which will really work for the patient.
Yeah.
Thank you, sir. Thank you.
Yeah. Thank you. Thank you, Professor.
Thank you, sir.
Good evening, sir.
Good evening.
I'm Shahina, sir.
Yes, yes, please.
Sir, sir, I have a small problem.
Okay.
I have a fear of driving a car, sir. Whenever I sit on a driving seat, I feel that I may hit anyone. I'm very anxious. So I have
Okay.
been trying for the last 3 years, but I couldn't succeed. So how
Okay.
to overcome this problem, sir?
Okay. I think I have already explained a few things. First of all, you sit in a stationary car and relax, listen to music, and if possible, start dancing in the stationary car. Take some food which you like ice cream or whatever food you like, so that in the car your brain learns to relax. Otherwise, the brain becomes tense and you start sweating and the palpitation occurs and then your heart rate goes up, etc. That is the habit which you have created. You have to create a new habit of relaxing in the car, which is a stationary car. Then start the car, start the engine, and don't move the car again. Eat something which you like, or sing some song or dance, and switch off. Do it some 3 times. Switch on, then switch off, like that. Then move the car just 1 meter and apply brake and stop and switch off. You move in the first gear. Okay. Again, move for another meter and switch off and relax and have more and more water if you feel agitated to the level of satiation. So if you try that, within 1 day, you will become all right. You will be able to drive the car. And do this in a ground. Do it in a ground, not in the road. Okay.
Okay, sir.
Okay, try that and then tell us what is happening.
Definitely, sir. Thank you, sir. Thank you so much.
Okay. Yes, Dr. Venu, you want to say something? Dr. Venu, please unmute and speak. Mic is muted.
What is our photo?
So this is Vinusha, sir.
Yes, Venusha.
Sir, please
So
continue.
I have a question.
Yes.
Sometimes you are saying to associate with some positive stimulus, like having an ice cream, chocolate, or something, so that it would form an association. And sometimes we are going through systematic desensitization, where we would slowly expose them to the threatening incident.
Okay. Stimulus, yes.
So threatening stimulus. So when can we apply this, and when can that be applied?
What's your question? I don't understand.
So in so many incidences, like cases which we have discussed right now, few of
Okay.
the cases we suggested with the where we will slowly apply systematic desensitization,
Yes.
and some cases where association of a positive stimulus has been introduced,
Yeah.
right,
In
like
some
eating ice cream or uh, chocolate or something which we really like,
yes.
to the
Yes.
threatening stimulus, along with the threatening stimulus.
Yes.
So when this technique can be applied, and when that technique can be applied, any differentiation, like?
No, you can use all the things in a particular case. One thing is slow introduction to the threatening stimulus, and also asking the person to respond differently, to enjoy the food or sing or dance. Okay, so the brain starts reacting with a different response other than palpitation, anxiety, sweating. Okay, so the brain is learning to respond differently, because responding with anxiety is not okay. It is not desirable. So you are training the brain to respond with a positive responses, enjoying music or dancing or laughing or enjoying the food, fruits or ice cream or whatever. Okay.
Because you have been discussing all these techniques for quite a long time, sir. So I can understand where to apply which technique. So I'm used to this.
Yeah, that's good. That's
Yes,
good.
sir.
And she is already practicing very well.
Thank you, sir.
And learning more by practice.
Yes, sir.
So
Good
one
evening,
of the important thing is when you practice, when you start learning more and more, you feel more confident.
So there is one question from someone else, sir. Rani is. I think.
Yeah.
Good evening,
Yes,
sir. Okay, carry on.
yes, Sudharani, yes.
Sir, good evening, sir. Actually, I
Yeah.
think some other asked.
Yes.
Shall I
Yes.
ask her? Let her ask. Afterwards,
Yes.
I'll.
Yes.
Yeah.
Your
So
video,
may I?
you switch on your video.
Yes, sir.
Okay.
So this is Rani.
Yes,
Yes.
Rani.
Good evening, sir. Good evening, sir. I have almost 3 questions. The first 2 questions are connected with the sexual fear. Can I call it sexual fear?
Yeah, you can.
Yes. In these 2 cases, I have seen a case where the man, the husband is very much scared of the hair, the vaginal hair, and the hair in the armpits. He literally, he couldn't perform any sex because of this thing in his mind all the time. This is the one thing I've come across in a case. Yes.
He's afraid of looking at the vagina of the wife. Okay.
Yes, sir. Hair, sir.
Hair, okay.
Hair,
But one
yes,
thing
yes.
with regard to the vaginal hair or hair
Yes.
around the penis, if
Yes.
the hair gets in the way, it may even create a bruise in the vagina or penis. So best thing
Okay.
is to shave the hair.
Right.
Okay.
Right.
Ask
Right.
the woman or the man to shave the
Right.
genital hair. That is the first thing.
Right, sir.
Second thing, ask him to look at the vagina and start laughing.
Okay.
If he starts laughing,
Right, sir.
things will be all right.
Thanks, sir.
Ask him to repeat 10 times to laugh.
Right, sir.
And the wife can also laugh along with it.
Okay, sir.
Okay, that will solve the problem.
Nice.
Yes, please.
Sudharan.
Yes, Sudharani, tell me.
Sir, actually, I have a friend who is a gazetted officer.
Okay.
What she says actually is, she asked me a question, sir. She has a problem. She likes only external sex. She doesn't like normal sex.
Okay.
So she gets satisfied by external things itself. So what
Okay.
is it any disorder? What
Relationship or what?
she doesn't have extramarital relationships, or actually even with, she doesn't like to, I mean, normal penetration and all, she doesn't like.
Okay. Then what does she want?
She just feels happy by, I mean, I don't know whether how to express it. Just by being what she said actually, only by feel like.
Yeah. No, you're not clear about the problem. Is she liking the anal sex or what?
Not anal sex, sir. Not that is what she doesn't like any penetration at all, sir.
She doesn't like penetration?
Yeah, only either by keeping. I mean, she wants. She says only by placing leg on the vagina or something. What she gets pressed or she hugs her husband, and that is how she gets satisfaction instead of normal sex.
Yeah. How
At
many
the same
children?
time, even sir,
How many children she has?
she has 2 children, sir.
Okay. Children's age are?
One completed engineering, sir. One
Okay.
is in school. I mean, just completed
Okay,
school and
okay,
into
okay.
+1.
Okay. Actually, her fear may be of a pregnancy. She doesn't want to become pregnant. That is why she is not allowing. Okay.
No, sir, she got operated as well.
Okay. Okay. She
Yeah.
got operated. Okay.
Operated as well.
Okay. But what is her specific problem? Why she doesn't want penetration?
That's what she asked me. So why? What is the thing wrong with me? Why I'm not interested? I couldn't understand. That's why I asked the same to you, sir. Like, what might
Okay.
be the reason for her not allowing her husband to have normal sex?
Yeah. Okay. Okay.
Perhaps she might have had, Ganeshan sir,
Yes, please.
he might have experienced a bitter experience, a kind of painful situation or through intercourse. That might be also one of the reasons.
Okay.
But what I asked the same question, sir. What she said, she enjoyed sexual life quite well and good with her husband, and she had a very good sexual life. But right now, she doesn't explain me. Might be I asked deep into the thing. What she said is only just I'm not interested. That's all.
No.
Yeah, I asked in all the ways. I asked in all the ways, sir.
Another reason,
Yes,
Ganeshan sir, another reason,
yes, please.
Her husband might have had having some kind of extramarital relationship with other people.
Yeah, that is possible.
Fear of that, he may get some kind of what can I say?
Disease.
Some diseases.
Yes.
Perhaps that might also be the reason.
Yes.
Sir, let me ask you one question, sir. If at all she has such thing, she doesn't even allow her to be with her, no, sir. Like she doesn't allow her to be close to her. But why she's allowing and why she's unable to have intercourse?
Okay. Okay.
You as counselor, you are supposed to ask the client.
Ask
no,
detail.
sir. That is what I asked all the ways, sir. I couldn't get that. So what might be the reason?
No.
That's what I.
See, if a gent is asking with the lady client, then there is a problem. They may not express it. But being a woman counselor, you can as well just drag it out and obtain the information easily.
I asked by all ways, sir. That's what. But that I couldn't get.
Dr. Sudharani, does she like foreplay?
She does, sir. She does.
She does. Okay. Now, ask her husband to wear a condom during penetration.
Pardon, sir?
Ask the husband to wear a condom
Okay, sir.
during penetration.
Okay.
And ask him to engage in foreplay for 15 minutes.
Okay.
No penetration, only 15 minutes of foreplay only for 3 days.
Okay.
That would excite her. After the third day, ask her to lie down and bend her knees and keep the feet wide and knee also wide, and ask her to squeeze her vagina and release it quickly.
Okay.
Okay, squeeze and release, squeeze and release, squeeze and release. Do
Okay.
it 10 times. Okay. Again, do like that for 6 times, 6 units.
Okay, sir.
Then she will get sexually excited and she can allow the penetration by the husband who is wearing a condom.
Okay.
Try that. Okay.
Okay, sir.
And
Thank
talk
you,
to
sir.
the husband also, talk to the wife also, and ask her to do this exercise. Then she
Okay.
will come back to normalcy.
Okay, sir.
Okay. Okay.
Thank you, sir.
Welcome.
Uh,
Yes.
See, okay. Dr. Sudharani happened to be the therapist. Okay, fine. What I think, why not the therapist? Say, say in a house there are about 3 bedrooms, I think. In one of the rooms, the therapist will be extending counseling to the couple. Fine.
Yes.
Then in another room, just by instructing, the instructions are over. Ask them to go to the other bedroom and there let her practically implement what the instructions given by the therapist.
True.
So
True.
that would solve the
Yes,
problem, I think,
Yes.
quite amicably.
Yeah, that's right.
Actually, not a client, so she's my friend actually. And moreover, it is not, I'm in some other place and she's in some other place actually.
Through
Like,
phone only you are giving a counseling.
yes, sir, almost whenever she gets any doubt and whenever she gets, not only she, but whoever gets any doubt regarding such,
Yeah,
they
now
make
I
a call
catch.
to me.
Now
That's
I
okay.
catch the point because you are friends. That's why she is not able to express her own problem. If it is
No,
somebody
sir.
else,
That's what, even to that extent, I could get, sir. I could extract.
am I right, sir, Ganesh, sir? Because
Yeah, that's
she
right.
could not be able to just reveal certain facts to the friend.
She is having some inhibition. Yes.
Yes.
In sharing everything.
Yes.
Okay.
No, sir,
That's-
because she doesn't hesitate to say anything. That's what. What is the thing is, she doesn't hesitate. She's a very close and intimate friend of mine. That
Okay. Anyway.
what that is what in return she asked me a question. What might
Okay.
be my problem, dear? What can I say, sir? I don't understand. That's what.
Okay. Okay. Now you try this technique and come back to us.
Yes, sir. Certainly, I'll ask her to
Yeah.
follow and I'll give the report to you as well.
Okay. Welcome.
Thank you, sir.
If you succeed, then you will become a pioneer.
Thank you,
Yes.
sir.
Once you get a success result, you should again at least inform Ganesh, sir.
Yes. Yes.
Or in the next program or next coming
Yeah,
program.
you can continue. Yes.
With all your blessings, sir.
Yeah, sure.
That blessings are not required. Ganesh's sir blessings are required.
Of all yours, sir, not only sir, all you elderly people.
Okay. Okay.
Thank you, sir. Thank you.
Welcome.
Okay, shall we go for conclusion, sir?
Yeah. Yes, please.
Yes, sir. Yes, sir. She's came.
Okay, so we are continuing the phobia session for the 3 consecutive sessions. So we have discovered about the fear of closed rooms in driving a car. So the stimulus is the car, and the response should be the pleasures like singing a song, ice cream, or having dancing or anything. So the first thing they have to do is sit in the car or be in the lift or be in the closed room for a while and sing a song. This has to be done for 10 times. If it is a driver moving or if the person itself wants to drive it, so they have to sit in the car and have an ice cream or any other thing which gives them the pleasure, and then move 2 feet or 1 meter and stop it. Then again move to 3 meters and stop it. So gradually increasing the time and the distance along with having the ice cream, so that the brain learns how to function effectively. Because faulty learning is disturbing the effective functioning of the person. So slow introduction or slowly responding to the stimulus in a pleasure way will help us in this session. On the closed rooms, in the lift, they can jump in and laugh or come out, jump out and laugh, jump in and count 1 to 5 or 1 to 10 and come out. Gradually that introduction to the agitated person is a stimulus. Then the brain will learn to train themselves so that the person will have the will function effectively. So if it is in case of an elderly person, they can laugh it. If it is like younger children, they can jump and jump out. So in the case of to 23-year-old person having a urge of sexual thoughts in any woman, even towards their family members, in that case they have to do the genital muscle relaxation, in which they have to relax their anal muscles 10 times, 20 times, and their vaginal muscles 20 times, or the penis 20 times, and then both together 20 times. So the other way is switch on the videos and laugh continuously for that, and then they can be quiet for some time. So the third way is sit on the road or any public place and look at the woman and breathe out through the mouth and breathe in through the nose. And the person is not allowed to masturbate regularly. It has to masturbate only once in a month. So the person who is doing her MBBS not able to pass the gynecology exam because of by not able to look at the baby coming out and the blood and everything. So the person we have to send them to the theater and ask her to look at the wall and breathe out through mouth and breathe in through nose and have some more and more water looking at the wall. This has to be done for 30 minutes and then turn to the surgical table with eyes closed, breathe out through mouth and breathe in through nose. This is again for 30 minutes, and then after this another 30 minutes she has to open and close her eyes quickly for 30 minutes, so that the eyes and the brain will coordinate and it will learn to accept the theater and everything. So this is how we have to treat that. Women standing in the queue in the temples or in movie theater feel suffocated. So we have to ask them to imagery technique, make the person lie down, close eyes and imagine that she is in the queue or going to some temple or a movie theater. So imagining makes the person that he is present in that temple, that we make her visualize in that way for 10 minutes. And later we can allow her to go to the temple. So another way is train to tolerate and by pushing them back, because by standing in the queue, the pushing by the people around can also cause some suffocation. So we have to train them to tolerate and push by pushing back to counteract instead of being afraid. So fear of escalator, as we discussed, it's a similar way. When the escalator is off, we make the person to climb up and climb down for 10 times. So the brain learns to tolerate. Sit in the car and ice cream. So the person who is scared of having an intercourse because of the hair in the vaginal and the armpit, the one thing is shave the hair and or ask the person, look at the person and start laughing, and also ask the wife also to start laughing along with him, and this to be done for 10 times. And the other case, we need some more information. So the gazetted officer who does not like the intercourse, I mean penetration, she likes the foreplay. So ask the person, husband to wear a condom during penetration, engage in foreplay for only for 3 days for 15 minutes, then lie down, bend your knees, open the vagina and start squeezing and relaxing for 6 times for 3 intervals. So this might help in getting the urge to participate. So that is all for today.
Good night.
Thank you.
Good night.
Thank you, sir. Thank you.